Morning, everyone. Hope you had a great weekend. I know I did. Used it to plan for this week ahead. As you maybe heard on the national news, they're calling this I think they call it Pearl Harbor Week or something. Maybe some hyperbole, but also the reinforcing the fact that this is going to be a big week in our country. I think it's also going to be a very important week in the city of Sioux Falls and in our state as well. And so, quick update on our case counts, COVID case counts in the city right now. As of noon on Sunday, yesterday, we had 104 confirmed cases in Minnehaha County and 23 in Lincoln County, and the state's reporting 240 cases. So that puts Minnehaha and Lincoln County at about 53% of all the cases in the state. And I'm expecting later today, when numbers are released, that percentage will jump even higher. The peak that we often talk about within the state is going to be driven by Sioux Falls and the MSA, just because of the density that we have here. So in addition to that data that we've been provided by the state, what we continue to look at, and a metric that we look at is case doubling. Okay, that's a very important number to look at. So if we had 5 cases on Friday and we had 10 cases today, let's say it's just an example, then our doubling time is 3 days. And so in 3 days, we would be at 20 cases then. That'd be another 3-day doubling. So we're looking at that doubling period, and that's something that the healthcare organizations are watching very closely as well. You want your doubling rate to be as high as possible. All right, and so as that doubling rate gets lower from 6 days to 5 days to 4 days, those are numbers that you watch very closely, and it also is somewhat indicative of the social distancing and mitigation metrics or efforts that you put in place in a city. So that being said, we expect our numbers to continue to increase. We are still expecting, obviously, the surge. We're at the very just early innings of that right now. But based on the caseload increasing and based on what we're anticipating, especially in this week, I'm announcing today what we're calling a Safer at Home executive proclamation. And I have that here with me today. And these are a new set of guidelines and initiatives coming from our office that we're asking residents and businesses to adhere to. And so I'm going to highlight a couple things in here. I'm not going to read the entire thing. It's about 3 pages long. But essentially what this does is clearly outlines the expectations and recommendations from our office to the businesses and residents in our city on how they can improve their current mitigation efforts and improve social distancing practices, which I feel have already been fairly well received, but now we're taking it up another notch with this Safer at Home proclamation. So first part is section 1, and a few things I want to highlight in that. That's the part about staying at home. And what does this mean? Residents are strongly encouraged to remain in their homes, except for solitary and or household outdoor activities for the promotion of physical and emotional well-being. So residents should limit visits to grocery store and retail stores to once per week and use delivery services. Residents should participate in organized religious activities via remote options when possible, when available, I should say. Residents should visit grocery stores and retail stores with a 1 shopper per household kind of rule. So have a designated shopper, a single shopper in your household who will do the shopping for your house. Whenever possible, residents should avoid taking any children still living at home with them on any essential shopping trips. Residents returning from extended trips or spending the winter in warmer climates should self-quarantine for 14 days upon their return. And then residents should continue to use the takeout, curbside delivery options for restaurants, things like that, and obviously with the social distancing guidelines from the CDC, continue to follow those. Second part of the proclamation relates to health care, and I'm not going to go through the details of that. It's really 2 things. Continue to follow the guidance of the CDC, call ahead if you're feeling sick, and also use drive-through pharmacy as much as possible. But section 3 is what we call safe practices, and there's been a lot of information, almost whiplash on what to do with the wearing of masks in public. We want to clearly cover that in the city of Sioux Falls. The most recent guideline from the CDC now is that wearing masks in public can be beneficial to slowing the spread of COVID. So our proclamation reads this, consistent with CDC guidance, residents over the age of 2 who do not have trouble breathing should consider wearing cloth face masks when they're in public areas outside of their homes, such as grocery stores, medical clinics, and other locations. Section 4 of this proclamation reinforces the importance of mental and emotional health and taking the steps necessary to ensure strong mental and emotional health measures are being taken if you struggle in those areas. And then Section 5 is the final section that's about business. And that section reads this: businesses not bound by the limitation of 10 or fewer patrons as originally set forth in ordinance number 28-20 should, whenever possible, limit their patron occupancy to no more than 20% of their posted occupancy and institute a safe social distancing strategy for customers outside of their place of business waiting to enter. So what do we mean by that? It's exactly what Walmart just did this weekend. They're limiting the occupancy in their store to 20% of their posted occupancy. So if your posted fire code occupancy is 500 people, you can have 100 people in your store at a time, or we recommend you have 100 people in your store at a time. Now, I want to say one thing, in that this is a proclamation. This is not, we don't have an enforcement metric to this, okay? And so I just want to be very clear on that. These are what I would call executive mayoral recommendations from our office that we're asking the public to take. We've done well with kind of the soft recommendations so far. We're taking a step further with what we call an executive proclamation that clearly delineates some of the things we expect right now from our patrons, from our citizens, and from our business community. Tomorrow night at our city council meeting, back in front of our council will be a second reading to extend the basically what we're calling the no lingering ordinance to April 22. It's currently set to expire April 8. That will extend the existing 10 patron or fewer ordinance in those business categories consistent with the governor's executive order that we have in place. We put it in place for 2 weeks with the ability for our council to re-extend that. That's what they'll be voting on tomorrow night. In addition to a whole bunch of just regular business we also got to pound through at our meeting tomorrow night. So with that, I will open it up and take any questions you may have for me. No questions.
Your impressions over the weekend, what did you see? You're driving around, you see stores, you see businesses?
Impression over the weekend is this: as the weather improves, people's appetite to social distance declines. So temperatures do this, social distancing does this. So I'd love to have just a crappy weather week. It doesn't look like we're going to have that. So that was part of the reason why we feel that more firm action and recommendations from our office need to come forward. So I do feel, though, and I want to continue to applaud the vast majority of the business community that's taken steps on their own to do their part in this. The Hy-Vees, the Walmarts, the small businesses, the Costcos that are all doing things with, 6-foot lines outside of Costco if you have to wait, and they put you like a cattle, in the chute is basically how they're treating us right now, and that's how we have to do it to stay safe. So I've really been impressed by the business community's response and how they've been working with residents on this.